You've landed at the edge of what medicine has known and what it's becoming. I'm Dr. Richard Rocker, and this is the Integrative Continuum, a podcast bridging biology, energy, and human potential. In each episode, we explore how quantum biology, frequency medicine, and ancient healing systems are transforming our understanding of health. This is where mitochondria meet meaning and blood work meets bioenergetics. Subscribe now and join me on the frontier of integrative healing, where science and soul are no longer separate.
Welcome, everyone, to the Integrative Continuum Podcast, where we explore the future of healthcare, the science of human optimization, and the art of truly person-centered medicine. I'm Dr. Richard Rocker, and today's episode is one I've been looking forward to. Today, I'm joined by Dr. Jane Donegan, a former medical doctor, homeopathic and naturopathic practitioner, and a long-standing researcher into disease ecology and childhood health. Dr. Donegan qualified in medicine at St. Mary's Hospital Medical School, University of London in 1983, and trained across accident and emergency medicine, paediatrics, neonatal intensive care, obstetrics and gynaecology, and general practice. In the early 1990s, she began studying homeopathy and naturopathic medicine, and since 1994, she has been researching disease ecology and vaccination, focusing not just on pathogens, but on the conditions that allow health or illness to arise. Her work has not been without challenge. After acting as an expert witness in a family court vaccine case in 2002, she faced years of scrutiny from the General Medical Council, ultimately being cleared of any lack of objectivity. In 2023, she formally left the GMC register, choosing to continue her work outside a system she felt no longer prioritized patient-centered care. Today's conversation is not about controversy. It's about health, immune resilience, childhood illness, and what modern medicine may have forgotten in its pursuit of control over disease. I think it's a conversation that's needed more than ever. Jane, you were trained across some of the most acute areas of medicine: A&E, pediatrics, intensive care. What originally drew you to medicine?
Well, that's a really interesting question, because what drew me to medicine was my mother saying you have to be a doctor. Because she was a nurse and she wasn't a doctor, and she wanted me to be a doctor because those are the people she admired. And so I always thought I would be a doctor, and I did sciences. And then I fell in love with languages. And when I was at school doing my GCSEs, I did ancient Greek, Latin, German, French, obviously in English. And I decided that's what I would make my career in, because I love languages. One of the reasons I love being a doctor is because I love communicating with people. It's all about understanding people, how they are, and what they say and what they don't say, and what they mean when they say whatever they say. But I used to babysit with his chemistry teacher, and he said to me, driving me home one evening, and I was telling him about my plans to leave the sciences and do languages. He said, if you love languages and you decide to make them your career, then you won't love them anymore, because they'll be the thing you have to earn money from. He said, I recommend that you keep languages as your hobby and you do medicine, because medicine will always be fascinating. And I took his advice, and that's what I did.
Sounds like great advice, yes.
Yeah, it was. Yeah. So that's why I chose medicine for myself that time, and it has always been that. And as a doctor, and even as a medical student, you have this unprecedented access to people's lives. You know, you just ask people questions and they tell you the answer in the best way they can. So it's an enormous privilege to be able to maybe to help people, but also to help them allow themselves to be helped, and to educate them. I've realized as time went by, and you talked about my journey and looking into health ecology, I've realized more and more why we're called doctors, and what many doctors have forgotten, because doctor is from dokeo, which is I teach or lead. And we're supposed to be teachers. We're supposed to teach the patients what their body is doing is correct and how they can support that, rather than scaring them into thinking that unless you have the latest drug and you fit the latest algorithm, that there's something severely wrong with you.
Absolutely. Yeah, I notice that as well when patients come in. A lot of them, they're actually quite surprised that you've taken the time to sit down with them, teach them, explain how things actually work,
Mm,
and they go, "Well,
yes,
nobody's ever done this before,"
yes.
or "I never knew that." And I find it quite, I shouldn't say not fascinating, disheartening, really, that so many people are not really getting the care that they actually deserve. Yeah.
Well, indeed. So for quite some time in medicine, I was working in the NHS fairly minimally, and people kept saying, "Why don't you just leave? Because they keep on persecuting you." And I said, "Well, the thing is, while I still do a few sessions in general practice every week, it gives me the opportunity to give other people the opportunity to have some explanation and teaching, and to realise that they haven't got flu symptoms because of some." Malignant god like Thor sitting on a cloud with a thunderbolt. It's a natural progression for how their life is now. And if they embrace it and manage it properly, they'll come out more healthy than they were when they got it, because they didn't have the flu because they caught it. They had the flu because they needed to do a detox, and because the body's really clever. Work with the body and you'll be fine.
I'm so happy to hear you say that. I mean, there's out of all the areas, the cold and flu thing, it really drives me nuts when people keep thinking they're catching something
Yes,
again, but it's a lack of understanding because the teaching really isn't there. And unfortunately, unfortunately, profit does come into certain things in medicine, and sometimes that takes precedence. And I think we have to be very careful with that.
even more so now that the doctors have one level of lack of understanding and following of algorithms. But now in the UK, we're having pharmacists doing prescribing. And I am a medical person on a summer camp every year. I have taken special separate qualifications. I'm not using the skills or the knowledge I learnt as a doctor, because I'm not allowed to do that if I'm not on the register. So, and I saw a child who had a bite, and he had an allergic reaction to it. And I did a few things and whatever, and it was fine. But his mother was a bit worried. She didn't think there was anything really wrong, but she was just worried it might be infected. And she went to the pharmacist, and instead of the pharmacist saying, it's fine, just leave it how it is, they gave antibiotics. And she said, "Oh, we had the antibiotics, and it's really made a difference." And I thought, "Oh," and I looked at it and I said, "But it looks exactly the same." And I thought, well, the doctor, or they should have said, "No, you don't need anything." But now that they get paid for doing that, plus they get the dispensing charge, plus they sell the antibiotics, they're just over-treating people.
Yeah, yeah, and overtreating, yeah, definitely. One common thing I see with patients coming in when I ask them about the medications that they're on, and then you see the folder come out or the big list of medications,
Mm.
and you see how it just confuses the body, the immune system, the all the biochemical pathways, and you're going, well, this how can this person ever get well when there's so much stuff going on, right?
Especially with the artificially low levels that we have of normal. I mean, saying that everyone should have a blood pressure less than 140/90 means that you're putting half the population on antihypertensive, anti-blood pressure pills. And the levels that we have for cholesterol, I mean, cholesterol in the 80s, it had to be total cholesterol. It had to be less than 6.5. In the 90s, less than 5.5. In the 2000s, less than 5. And I went to a conference, a postgraduate conference in 2004, when they were saying there's a benefit to giving statins for people with um, a total cholesterol of 3.5 and above. And I thought, benefit to whom? Certainly not the patient, not when they're having their
Absolutely
problems
not.
with their muscles, their kidneys, and all these other things. Plus the fact that we need cholesterol. It's the building block of our steroid hormones, our sex hormones, our crucial vitamin D hormone. And of
Yeah.
course, and ignoring the fact that there are studies which show that having a low cholesterol predisposes you to cancer.
Yeah, yeah, absolutely. Um, I have a chart. It's so important. I have a chart when when patients come in. I just go, these are all the things that your body uses, fats and proteins, in order to build and maintain. And people are astounded on by that because they don't understand. Well, they've never learned it, so they don't know. But once again, it's explained to them, and again, like you say, the doctor doing their job and teaching, then it all starts to click in and make sense.
Yes, but also the demonization of fat since I think it was 1977,
Yeah,
and I say to them, the man who did some of the major studies, he fed cholesterol to rabbits. Now, what don't you know about rabbits? What do they eat? Well, they're herbivores, they eat grass. You only get cholesterol in animals. So if you have something that's evolved for eons, not eating meat, and then you feed it meat, it's no wonder it's going to wreck its system.
yeah, 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 absolutely. And we see what really drives me nuts in that regard there when I see vegan dog and cat food,
Oh,
and
yes.
then they wonder when their animals, they only live a third of the lifespan. They don't have any hair. They have joint issues and problems and
Excellent.
human diseases. And I'm going, well, isn't that interesting? And we're very much the same when we do that, aren't we?
Well, we are indeed. So in terms of a vegan diet, I think a vegan diet is absolutely fantastic for detoxing. And I think that, but I think that you can't sustain it for more than 2 or 3 years. And for
Yes.
some very heavy, hot, red, scurfy, scabby, livery, not the low liver, the high liver type, sanguine people, that they can do with a bit of a vegan diet, but it's not sustainable. It's only okay as a detox. And the thing about detoxes is that you don't do them all the time.
Yeah, yeah, absolutely, yeah. So, okay. So when did you first begin to sense that the conventional model of illness didn't fully explain what you were seeing clinically?
Well, I think it was probably through my vaccine studies, because I didn't really think that vaccines were anything other than the best thing since sliced bread. I'm not so keen on sliced bread. I started looking at homeopathy from the point of view of, well, I should say scoffing. One of my things that I like to do is I like to read and study, not in great depth, but study things I think I don't agree with. I think if you just read all the things that you agree with, you don't learn. And also, when you read stuff or you study stuff that you think is wrong, you can have that satisfying feeling of thinking, well, everybody thinks that this is true, but this is wrong and this is wrong and this is wrong. So the reason I got into homeopathy was because I was working with a colleague when I was doing obstetrics and gynaecology, and she'd done her house jobs, the pre-registration, post-qualification jobs at the London School of the London Homeopathic Hospital, which has been eaten up by University College Hospital now, as about 3 rooms. And I thought she was nuts, and she arranged this conference. I thought, well, I'll go to the conference because it's only a tenner. We're talking about back in the 1980s. And as well as that, you got a little box with 10 remedies. And I went along to listen, and I thought it all sounds very airy-fairy. But there was a young man who said that he had this great uncle who had really bad stomach issues, and he'd had half of his stomach cut out, all these Whipple's operations and things that we don't do anymore. And he'd had all these other things happening. He'd had loads and loads of surgery. He'd had loads and loads of beta blockers. They hadn't started with proton pump inhibitors that they give everybody now. And he gave him one single tablet, not one every day, one single tablet of something, and he got better. And I thought, that's bonkers. But it was interesting enough for me to think, for another tenner, I'll buy this book, which was called Bowricker's Materia Medica. And it looked like a Bible, with the little onion skin pages and the slight redness across the outside. And it was written in the early 20th century by Germans living in California and drawing on 19th century and 18th century writing. So the language is quite archaic. So it appealed to my sense of the arcane. I quite like arcane things. And I think life is more than what you can touch. And so I took that away, and I just had it, and I looked at some things, and I couldn't make head nor tail of it. And then I had a patient when I took over as a new partner in general practice. I took over all these other patients that the previous partner had. And one of them was a girl who'd had learning difficulties, and she had a yearly sick note, and her mother came in to get it. And I said, well, I need to see her once myself. So she brought her in and then said, now that she was 44, she was becoming menopausal, and she needed something for these almost paralyzing hot sweats. So I thought, well, I can't give her hormone replacement therapy, because even then I can't counsel her about the risk of breast cancer. We used to use things like atropine, which we use for drying out people's mouths, but that was sort of coming out. That's before surgery, but this was sort of coming off our repertory, off our British National Formulary, as we were changing over to more modern things. So I thought, oh, maybe I need to try this homeopathy thing. So I looked up a few bits, and then the first one I came across was called Calcarea carbonica, and I thought, well, it must be more complicated than that. So I spent ages looking, and I'd write a prescription in 2 weeks, and I'd arranged with a pharmacist that he'd dispense it, because in those days you could write homeopathic prescriptions on NHS prescription pads. And it got nearer and nearer the time, and I thought, well, I'm just going to give her this one dose of this Calcarea carbonica in a 10 m. And I did it. I told her it was there. She went and collected it. And then I saw the mother a few weeks later. She was a frequent attender because particularly for that generation. Now everybody wants to talk about their emotions, but it used to be that the way you coped with things like having a daughter with a disability who's now 44 and you've looked after her all your life is by having physical symptoms. So she'd come in quite often and I said, "Oh, how is your daughter?" She said, "Oh, she's better." I said, "What?" "What?" And she said, "She's better." I said, "What do you mean better?" She said, "Oh, I don't know. Her father says when she comes in from getting the paper, she doesn't have all that sweat down her back and doesn't have to change her clothes." And I thought, what? This is weird because there's nothing in the remedies. There's nothing pharmacological in the remedies. It all works on energy.
Yeah.
So that's when I started studying homeopathy, and sort of studying homeopathy and studying disease ecology, I started realizing that the body, particularly in homeopathy, it's got this vital force, which has a housekeeping. It's intelligent. It has a housekeeping facility. It keeps you healthy and happy and running along the way you need to be running along. And when you look at the teachings of Hahnemann, he doesn't say you need a pill for every ill. You have to have correct conditions. You know, you can have all the homeopathic remedies in the world you might like to have, but if you live in a damp fungal cellar, then your asthma's still never really going to get better. You have to have clean water, ventilated housing, adequate food, someone to love and look after you. So that's when I started looking and realizing it's not all these outside things, and it's not even this germ theory. I
Right.
started understanding about the germ theories. I started looking at vaccines and realizing that the books I'd looked at, who were either by doctors in America or Australia, or they weren't doctors from the UK, where they showed all the deaths reducing before there was never mind vaccines, before there were even antibiotics. And that's because of clean water and walling in the sewers, and the Victorians, you know, who used their money that they got from slavery and empire to make everybody here a lot more healthy by fixing the infrastructure.
Yeah. Yeah.
So
Absolutely. Yeah.
that's the
Yeah.
first time it really dawned on me. But the thing is, in medicine, we were taught, oh, these are the vaccine preventable diseases and these are the social condition preventable diseases. But we never asked the question, well, if these ones were prevented by social conditions, how do we know these other ones weren't as well?
Yeah. Yeah. Absolutely. I think this is coming more into the limelight these days, a lot more, especially through the COVID era. Let's call it let's call
Yeah,
it
era,
that.
that's a polite word.
And yeah, it's a highly inflammatory topic. But I think from what I'm seeing on my side of things, especially here in Ireland, is that whether you're for or against, and it's created a lot of inquiry into it. And um, what I'm pleased to see is that a lot of medical professionals are looking into it, and they're going, "Hey, well, wait a second. This doesn't really make sense here. And if this doesn't make sense with this, maybe we need to go back and look at some of the other
Mhm.
areas and see, well, does that theory hold true to this as well?" And I think now it's kind of being stirred up a little bit more here. Um,
Do you find that? Because I find it quite disappointing that most people regard anything to do with any questioning about the COVID narrative as some kind of conspiracy theory. But I saw them trying to do it with MERS. Well, I saw them trying to do it with swine flu in 2009. I saw them trying to do it with MERS. I saw them trying to do it with SARS. I saw them trying to do it with Zika. And then once the World Health Organization declared this pandemic with COVID, it was just like bingo, they're doing it. And of course, almost nobody died of flu. They all died of COVID. And I remember, and most people don't remember, I remember in 1999 to 2000, so many people were dying of whatever the winter lurgy was in that year that uh, NHS hospitals ran out of room in their mortuaries to put the bodies. They had to hire refrigerated lorries and have them in the car park with their engines running, refrigerated, to put all the bodies in. They cancelled the doctor's leave, they cancelled the nurse's leave, they cancelled all non-urgent surgery. And nobody can remember this. The reason I remember it is because they were trying to make out that the people in the refrigerated lorries hadn't had a flu shot. And I knew they had had a flu shot. And but nobody remembers because we didn't close the houses, we didn't close schools, shops,
yeah,
pubs. We didn't make people wear masks. We just carried on as normal, like we've always done.
yeah,
It was so, the word overprecedented is overprecedentedly overused, but it was unprecedented what
yeah,
they did in terms of the response to this.
yeah. We'll see what comes out of it. Hopefully, like one of the sayings that I really dislike is that the science is settled, and I'm like, No, I don't think the science is ever settled, and the only way that we progress is by asking questions. So,
100%.
um, hopefully that will continue. We'll see.
Well, you were saying that some doctors are now questioning things they've learned. If all the doctors had remembered the immunology they learned in their first fifth year as a medical student, they'd have just said this is rubbish, but they didn't. Because it seems to be that once you become a doctor now, you turn off your ability to analyze and your critical faculties, and you just don't think anymore. You just followed guidelines. And so few doctors actually read papers, original papers. They just read the
Abstract.
regurgitated crap,
Yeah, yeah,
as I call it. Yes, that's all.
yeah,
If they read that much, I mean, most people just look at guidelines because there is a big thing in medicine which is called protecting yourself. And if you follow the guidelines, which are guidelines, they're not law, they're not statutory, they're just a guide. But if you follow the guidelines and something goes wrong, you can say, oh, well, I was following the guidelines. And so you're protected. So sometimes people feel that the doctor is really being angry with them. They feel they're wrath. And what they're feeling is the doctor's fear and annoyance at you're putting them in what they regard as danger
yeah,
professionally.
yeah. Well, I think it comes back to again, the teaching, and I think we need to spend time with the patients these days. And when you're left with 5 minutes to work with somebody, you really
Mm.
can't do anything in that
No.
amount of time. At least taking proper histories and looking at somebody's story. And one of the things I do is when people come, I just get them to, I say, just talk, just keep talking. And I said, I'll write down what is relevant, and I may ask
Mm.
you a question here and there. And 80% of the time when they're talking, there's going to be so much valuable information in
Yeah.
there that you can piece that puzzle together. So, yeah. But again, in this day and age, everything is so quick and fast, and we're in a rush, rush, rush. And sometimes the answer is not what we need to add in, what we need to take down, how we slow down, and just let things relax. Yeah. Yeah.
And observe people. I mean,
Yeah.
people say one lot of things, but when you observe, you get an awful lot more information.
Yeah.
And of course, I'm not practicing as a doctor now, so I don't examine people. But examination has really gone down the pan. People just don't examine people. They send them off for a scan, they send them off for blood tests, they send them off for this. You know, I was told by one of my crude bosses that if you don't put your finger in it, you put your foot in it. And
Yeah,
you
but
have
you're
to
very
examine.
right. Yeah, you're very right about the examinations. When I was young, now I was born and raised in Canada, but I don't think it was much different in many places. When you went to the doctor, you were there for 30 minutes, and you got a head to toe examination, and let's bang on your knee and check in your ear and your
Oh,
nose and
yeah.
your mouth and everything. I have never seen that done anymore.
No.
Yeah, yeah. So uh, that's an issue. Okay, so you mentioned ecology before. So you've been researching disease ecology since the mid 1990s, I believe it was. So
Yes.
for listeners who have never heard that term before, how would you explain that?
Well, ecology is sort of like the medium that you're in and how everything's connected. It's just got the same root as economics. It's from Greek, eco, which is a house. So it's how it all fits together. A household runs by all sorts of different facets working in the house, and it's the same with diseases. It's not that there's this evil germ and it comes along and it gets you. And two things which have really messed up how people think about life and health are germs and genes. So it used to be that people could see, it started before that. So it used to be that what killed people was famine or war. And war killed them because it killed them physically, but usually also because often the theatre of war was in the fields where you would grow food. So that's what would kill people. And then gradually in this country, it was about the 17th century, we started enclosing the land. So people who were very poor, who would have been able to graze their pigs or whatever on acorns in a forest, couldn't do that anymore because the forests were blocked off, and they could grow bits of uh, various things like wheat or corn or something. They wouldn't have that anymore. They just have their houses because everything was being taken into large estates, and so it meant poverty in the countryside. So at the same time the Industrial Revolution was starting, there was this mass migration from the countryside into the towns, which were pretty much jerry-built, plus with pretty appalling factory conditions. And so once you get people in a large conglomeration, you have to do things like civil engineering. When you're in a little hut somewhere in the forest, you can dig a hole for your excrement or bury it somewhere or turn it into compost. But you can't do that when there's loads of people packed into one street. So people started dying. I mean, even the Greeks, the Greeks built all their beautiful temples and everything and gave us all this lovely literature. But unlike the Romans, they were no good at civil engineering. And that's why people like Pericles died in 500 before the Common Era they think it was probably typhus or typhoid or something like that. So you have to have civil engineering. So when you look at, for example, how the working class in Manchester were living, and we know about this because Engels, from Marx and Engels fame, came over as a young man to Manchester and described the condition of the working class poor. There were unpaved streets full of sewage. They were all in one room. It was really cold, so they'd block everything off. They'd have smoke in there. They'd have, as I said, the water be unclean. They get it from the river where the fogs were coming up and where the feces were coming up. And when you look at how poor they were, how poor their food was, how denatured it was, they do things like put white arsenic in milk to make it so they could dilute it and make it look more milky and sell more. It's not the question of why did so many people die. It's a question of how did anybody manage to stay alive, never mind scrub up and get to church on Sunday, with a clean white shirt. I don't know how they did it. And as I said before about the Victorians, they started realizing that if they didn't start cleaning up these cities, not only poor people, but rich people were going to die as well. And what they observed was that the people who lived in smelly, disgusting, ugly places tended to also be smelly, disgusting, ugly, and ill and die a lot. You see, we just think that our senses and beauty are just incidental, but they're not. They're actually signals that we've evolved to know what it means. It means something. So it didn't really work with the Elizabethans with their pomander, with the orange with the cloves in it, when people were dying of plague that was carried by the flies and the fleas biting them from the rats. But it does make a difference. So they started making things look beautiful. The hospitals from those times, they're in beautifully manicured grounds, the ones we're all selling off, and they've got mahogany staircases and parquet floors and big windows so you can look out at nice things. And they just intuited that people who live in a place where there's sewage flowing down the middle of the street full of rats are going to be less healthy than ones where it smells nice and it's okay. So they started working on this basis of cleaning things up. And we had great sanitary engineers like Chadwick. And that was going well. People were dying a lot less, if you can say that, or they were living more, let's say living more, because everybody dies. It's just a case of whether you die prematurely or not, and whether you have a nice, healthy life before you actually do that. And then Pasteur and co. came along with their germ theory of disease, which was that you meet this germ and either you had it before and you lived, or you had a vaccine and you got antibodies, otherwise you're going to get it and probably die. And as I say to people, this is not true because you know that on a bus, when someone has this year's flu, not everybody gets it, even though it's new. We know it's new because they make a new vaccine every year. It's nothing to do with you meet the person with the germ. We're covered in germs all the time. They're our friends. We have about 2.5 kilos of them in our gut, which is, I would say, well, that counts for my weight. It's the 2.5 kilos of nice bugs. And at the time, there were people scoffing at Pasteur. They were doing things like having a glass full of cholera vibrios. The bacterium to do with cholera is like a corkscrew. They call it a vibrio. They were drinking that and they didn't get cholera because they weren't at the age of starvation. In fact, one enterprising chap called Mechnikov, who was a Russian living in Paris, he actually made gelatin capsules with feces of people in it who had cholera. I don't know if he took them himself, but he gave his disciples capsules to eat, and they didn't get cholera because they weren't on the edge of starvation. But Pasteur won out. He was a pretty good showman. And also Europe, I know we have an EU, but as you know, the UK has left it. But Europe traditionally has been fighting itself for over 1,000 years, and they like a good fight. And we understand the metaphor of war. And a lot of the metaphors of medicine are war. So, we had this germ and we could fight it and we could have armamentarium, we could have weapons, we could destroy it. So we liked all of that. And the other thing was the genes. So there was the monk Mendel, and he was very lucky with his pea plants that the red ones and the white ones mate and you get a pink one in between. Because most things aren't like that. Most things are multifactorial and not and environmental. But once we saw the genes, we said, here's the genes, and now we can have all the genetic departments, and we'll map out the human genome, and we'll be able to tell you that you're going to die of a heart attack when you're 37. Well, apart from the fact that who wants to know that anyway, that's not how it works out. So they eventually worked out the human genome and found out that about 70% of our genes we share with a fruit fly, so it's not just genes. And it's not whether you have the genes in most cases, it's whether they're switched on. So some things switch things on, like smoking or whatever, but it's all the environment. So now, to acknowledge the environment, they call it epigenetics. They don't call it environment because they'd lose the funding from their genetics department. They call it epi, that's Greek for on top of genetics.
Yes.
And we're just going down to the fact that everything is the environment, whether you have what we call infections, whatever your gene status is. Okay, so haemophilia or some of the motor neuron diseases, those are to do with one or two single genes. But most things that affect most people on a daily basis are multifactorial, and they're determined by the environment, not by the fact that you have the genes.
Yeah.
So
Yeah.
that's what disease ecology is about. It's about working with your body and also understanding how intelligent the body is.
Yeah.
Yeah.
Yeah. I would agree. When you say multifactorial, again, in my experience, I've never seen just one single issue. There always seems to be some co-issues with that. Even a good example, I suppose, is Lyme disease. How many people have been tested for Lyme disease, but
Hmm.
they haven't realized they have 4 to 6 other co-infections along with it, and that's why they've never been able to treat it properly,
Hmm.
right? But I think if we're not, again, it comes back to, do you have somebody that works with you, a doctor or practitioner, that knows how to ask the right questions, that knows how to do the right tests as well? If you're only testing, because I like to do a lot of bloods, and I'm always amazed when somebody gets a blood test and there's only like 15 blood markers on it. I'm going, well, how are we going to figure anything out here? It's not enough information
Hmm.
for me to assess anything with it, even if there's no inflammatory markers or anything like that. So again, even the medical approach, I think it needs to be multifactorial as well.
Yes. Well, there's many types of trace elements that nobody ever measures at all. It must be said, I'm not a big tester. I'm a very big tester of people's vitamin D levels,
Yeah,
which of course the NHS doctors are told not to measure it unless there are actual symptoms. When you've actually got squashy bones or deformities, that's when you're supposed to measure it.
yeah,
And there are if you can say, so many fewer people who would have died during COVID, and at all times, if we had people with decent vitamin D levels, because it's not a vitamin, it's a hormone.
yeah,
And the NHS says, oh, if you put your arm out for 15 minutes a day in the sunshine, that will be enough. And of course, it won't. And of course, also, even in your food, you can be eating 3 eggs a day and half a packet of butter and some lovely rarefied North Atlantic cod liver oil. But if your absorption surface has got any type of dysbiosis, or you've got inflammation, you're just not going to absorb it. So I normally recommend that people put things under their tongue, and then you can
yeah.
ignore the gut.
Yeah, I agree 100% with that. Yeah, it's just because we eat something doesn't automatically mean that you're going to get the benefit and absorb
Hmm.
it. So again, there are many different factors there that need to be looked at. Yeah. So okay. So how does it? So okay. So how does a disease ecology perspective differ from the modern focus on identifying and suppressing pathogens?
Well, because you don't look at, because they're not pathogens. So pathos is illness or pain,
Yeah.
and gen is generating, like Genesis. And so they say, so for example, we have a vaccine called HIB, Haemophilus influenza B. It's nothing to do with flu, but they
Yeah.
thought it was a long time ago. Now that comes in A, B, C, D, E, F, G. But we say the one that causes invasive disease is B. And of course, it doesn't cause invasive disease. It just sits in your nose. It sits in your nose, and it limits the ability of the pneumococcus to expand due to how the body reacts to the HIB or the Haemophilus. Now, if you get rid of HIB, the B one, well, I saw a child who was left permanently injured from meningitis from Haemophilus influenza A. He'd had a HIB shot, so he didn't have B up there, but he had A. And if the circumstances around him that allowed it to leave his nose and go into his brain to give him meningitis were such that it was going to happen. It was going to happen irrespective of whether he had a Haemophilus there. And if he got rid of the Haemophilus, it might have been a pneumococcus, because
Mm.
these bugs are there all the time, but they're only problematic when we change the conditions, like the hens with salmonella. Well, all hens are covered in salmonella. We've all got salmonella in our gut. It's only when you herd them into totally inhumane conditions where they're stuck in an 18-inch square cave on metal and given a tray that runs by them to eat, and they have to have artificial levels of light and just produce eggs every day or get fat so they can be slaughtered at the youngest possible age. Then they'll get salmonella, and you have to give them loads of antibiotics. But it's because they live in such horrible, criminal situations. I'm a meat eater, but I think you need to be nice to the meat that you eat.
Yes.
And and people say, oh, well, they have to do it to make it affordable. So eat less of it. Eat lentils, and then buy some expensive meat that's had nice things done to it. Because you eat the torture. You don't just eat the chicken. You eat the torture as well. And so there's a whole multifactorial thing to do with that. And also, you get back on yourself. They talk about the microcosm being a reflection of the macrocosm. So you have the sun with all the planets swinging around it. That's the macrocosm. And in the microcosm, you have the nucleus with all the little electrons spinning around it. And when I look at the enormous increase in cancers, and I look at something like a picture from the moon taken of the Earth, and you just see this grey concrete spreading over places. I mean, what does cancer do? Cancer is an undifferentiated cell that takes over space that was taken up by cells that had a proper function. And the more bad the cancer is, the less functional it is, the more undifferentiated it is. It just spreads and takes up live stuff. And that when you look at the Earth, you can see just this concrete spread, and not so much roads, but people concrete up their drives. They go, oh, it's so much less bother than having grass or plants. And I think, well, if you want really no bother, you could just be dead. Then you wouldn't have any bother, depending on where you go. And so you wonder why there's so there's all sorts of reasons for having more cancers, like the petroleum byproducts and the EMF and stuff like that. But there's also what we're doing to the planet. So everything is connected. It's an interconnected web. And I spent a long time thinking that there were bacterial diseases and viral diseases. And then people say, oh, there's no such thing as viruses. Well, that's not true, because there are things that people call viruses. The question is whether they're infected particles or whether they're the products of cell breakdown.
Mm-hmm.
So I eventually realized that actually Patrick Quanton, who's another ex-doctor, he used to practice holistically in the Channel Islands. And then they came along, and then as time went by, he realized that he needed to sort out people's diets and their lifestyle and their Weltanschauung, how they think about things. And so his levels of what he prescribed went down and down, and he was visited by the Prescription Pricing Authority, the ones who were supposed to stop you spending too much. And they said, you're not prescribing enough statins, you're not prescribing enough blood pressure pills, your patients are suffering. He said, where? Show me where they're suffering. Show me the deaths or the A&E attendances or the hospital outpatients they're going to. They couldn't do that. But anyway, they said, you're not prescribing enough. So he just deregistered because he thought, I'm not working in this environment. And I remember reading what he wrote once. He said, how do you know that, because viruses are called DNA and RNA. He said, maybe they're just the breakdown of cell products put in a lipid bin liner and chucked out. And that made a lot of sense to me, because you have something like measles. Now, if you have measles, you have a particular type of breakdown. That's why you get the particular type of rash. You also have a particular type of aftermath in terms of your emotional and physical development. So presumably when you have measles, you break down the measles breakdown cells. Measles breaks down certain cells. So it's going to break so that all the cytoplasm and the other parts of the cell, they'll all just be got rid of. But there's DNA and RNA from those cells. And so how do we know that? So when you have the measles and you see all this, all these what we call viruses that are supposed to be infected with RNA in their little lipid bin liners, how do you know they're just not the breakdown products? And it's like the innocent bystander effect. The man standing at the bus stop and then the car comes and knocks somebody over. Did the man do it? Did he make it happen, or was he just watching it? And so all those, and then there's the big question about, so why does everybody, why do all these children get measles? One gets measles, another gets measles, another gets measles. Well, children are always about to go up a developmental step, and you get to the point where they're just poised to do it. And then you get this, if one person does it, it almost like it makes the other people, it's like hormesis, it just makes them, because they're there, ready to go. And there's all sorts of phenomena we don't understand, like, for example, the one where a whole load of women, like student nurses or students living in the same flat or dormitory, start synchronizing their periods. How does that happen?
Yeah.
There's lots of things we can't explain with our rational explanation, but we are an interconnected web, and we have to work with it.
Yeah, I think there are so many things that we don't see and perceive, that are influential. And of course, when you start talking to people about energy, some people will get it, and some will go, "Oh, you're one of those hairy
Yeah,
fairy
woo-woo
type
people.
people," you know.
Yeah.
But yeah, everything is energy, everything is frequency, vibrations. I mean, this is physics. Um, Now, I know it's not the most exciting topic for people to read, but for those that dig into it, you'll find that. So, okay, you mentioned children. So, yeah, I'd like to get a little bit more in children. So, from a disease ecology point of view, how were childhood illnesses once understood in terms of immune development?
Oh, well, now we say you get the illnesses and then you get the you either die or you get the
Yeah.
antibodies, and then that's it. And then we give you vaccines because then you can have the antibodies without the discomfort or the risk of dying. So there's two things there. One is it's crucial how you manage your fevers. Fever is your friend. I
Mm,
do lectures on Tuesday evenings online, and the one I repeat every 4 to 6 weeks is fever is your friend. Because if you can manage the fever, whether you vaccinate or you don't vaccinate, you need to know how to manage the fever. And so many people get bad outcomes because they fight the body in what it's trying to do, particularly with paracetamol and ibuprofen.
yeah.
Because the body is really intelligent, it's intelligently created, it's really clever. It keeps the body at exactly the correct temperature for doing all the processes it needs to do with the minimum of energy use, because for every extra bit of energy you use, you have to take it in. You were talking about people can eat things and not absorb them. You have to take it in, you've got to absorb it, you've got to put it into the building blocks, you've got to get rid of the excess. And the body, unlike some of our governments, is very economic and it keeps the books straight.
Mhm.
And so you have to understand that when the body decides to increase the temperature by 1 or 2 degrees, it's doing it because it really needs to do it. And children are much better at doing this than adults. Children have a much bigger vital force. We hope, from babies, they're going to live till 120 in good health, So they've got a big, strong vital force. They don't tolerate a lot of toxins, and they're doing a lot of development. And every time they need to go up a developmental step, whether it's producing a tooth or whether it's walking straight and not banging their head on the side of the furniture, or whether it's an emotional development like being sent to a childminder or being sent to school, before they go forward, they need to clean out. They need to clean out their rubbish. I describe it as boxes, a certain amount of rubbish from, rubbish, pollution in the environment, to too much fast food, not enough time outside, their parents arguing, all these, things that you have in life.
Yeah.
So, fever. And what happens when they have a fever? Well, the liver detoxifies faster, the kidneys filter out faster. Usually your appetite goes down because if you're trying to clean yourself out, you don't want to be taking in more stuff that you have to process. And actually, 80% of your immune cells are produced between the back of your throat and the other end. So when you're not eating, you're allowing the gut to rest and to allow all these immune cells to be produced. You might have diarrhea and vomiting. That's a quick way of getting stuff out. And you might have a rash, depending on, what you have. And if
Mhm.
you support them through that, which you don't have to go to medical school for 5 years or do lots of postgraduate training to do, you basically, you open the window, give them lots of fluids, don't feed them and let them rest. It's it, People like to hear it a bit more than that.
Yeah.
I
Yeah.
try to tell and I give examples, but that's basically it. Then they come out the other end of it, as I said, better than they were before. And when they don't have the opportunity to do that, you hear it outside the school gate all the time, particularly in the winter. And then he got this, and then she got that, and then he got this, and then she got that, and then they had the third set of antibiotics. And it's because the child is trying to empty their box and you keep impeding them.
Hmm.
And they'll keep on and on trying to do it. And in fact, the ones who never get any fevers, sometimes it's because they've got a fabulous environment and fabulous food and stressless life. But for most of them, it's because they don't have the energy to do it. And all these fevers in children that people are so worried about, they only usually last till they're about 6 years old. And then they become far fewer. And we are all old, all the old people over the age of 6, we hardly have any fevers. And that's not because we've got such a great immune system, we've got all these antibodies, because we're subjected to lots of different insults, in terms of all the slings and and whatever of life. But we just don't have the vital force to do it. And in the end, that's why we die. We die because we can't have the fevers that clean us out like children do. And of course, when you give the paracetamol and the ibuprofen, you're fighting the body because you're lowering the temperature, making all the processes go slower. Plus, now the liver, instead of detoxifying you, has to detoxify the paracetamol. And then the breakdown products, some of them are not very nice. That's why we're trying to get rid of them. They call them free oxide radicals or reactive oxygen species. I never know why they have to have so many names for the same thing. But what does oxygenation do? It burns it. It's like having a 5-year-old with a blowtorch going around your sitting room.
Yeah.
But the body being intelligent, it has things to soak them up, like glutathione, which we make, and vitamin C, which we don't make. And one of the pathways of breaking down paracetamol uses up glutathione. So you've got a double whammy here. And some people listening to me think, oh, I'll make sure I give them ibuprofen. Well, I think if you've got ibuprofen in the house, you should do the cork up really, the lid up really tightly, put it in several Ziploc bags and put it in your bin. It's awful stuff. It's not good for your kidneys. It's not good for your heart. And it can make ordinary, what we call viral illnesses, have bacterial superinfections that give you awful skin problems.
Yeah, absolutely. And intestinal permeability. Yeah.
Yeah, it shouldn't be used at all. So if you're going to use anything, use paracetamol, but don't use ibuprofen at all. And people say, oh, but I take it for my joints. And I say, well, I'm talking about children with fevers because or adults with fevers because that's a particularly vulnerable time.
Yeah.
And of course, you have to be careful anyway with all the things that we do that we mask with the anti-inflammatories that enable us to carry on with our incorrect lifestyles by blocking out the signals we should be getting.
So sometimes we just need to get out of our own way and let the body do what it needs to do.
Yeah.
And a lot of times it's just really the simple things. You mentioned the fevers. I think, something that I recommend and I have in my clinic here is we have an infrared sauna because what do I want to do? I want to create that heat, that fever-like thing so the body can burn up and get out what shouldn't be there. So we're really reducing the toxic burden.
Exactly. It's all about reducing the toxic burden, and the body can do it. But by the time we've got a long time down the road, as adults, it's much more difficult. Children, they do it fine, so long as you don't interfere too much. And to just give an example, I've just decided to chuck out most of my past life from my house, which included also cleaning out the cellar. And I realized halfway through it, I thought, I'm not even wearing a mask. And I thought, you know what? Because I see all these people who come along and they go, well, I'm like this because of this mold, or I swept the sitting room and it's the dust. And I'm down here sweeping up Edwardian dust and mold because there's a river that runs underneath. And I thought, I should really have probably put something on. I don't really like masks very much. Mm-hmm. And so I thought, you know what, my body will fix it. And so I inhaled all the dust and it did. I got this disgusting stuff from my nose, which was pretty exciting to look at. And I had disgusting stuff from my chest because I thought, are you setting yourself up for something bad here? And I thought, now have faith in my body. I'll get some chest thing and I'll cough it all up. I'll get some sinus thing and I'll blow it all out. And that's what I did. And that's what it's done because the body's pretty smart and it can manage with most things.
Absolutely.
And I do take vitamin C, and I have a good vitamin D level.
Yeah, that's extremely important. I know you mentioned that earlier, the vitamin D, and I think people don't realize how important the vitamin D is because you can't really absorb your minerals if you don't have enough vitamin D levels. And again, if you look downstream of that, then that creates a lot more, the environment, it creates a more, I say, acidic environment versus alkaline, and disease likes to grow in that acidic environment, doesn't it? So back to that,
it does.
back to the basics, back to the environment again, right?
Yeah.
So what do you think we've lost by framing childhood illness purely as something to be avoided or eliminated?
I think we've lost the ability to create healthy bodies. Because the reason that we have these childhood diseases are to mature us. Each one has a different type of maturity. And there was that great 10-year study in Japan, which looked at cardiovascular disease and strokes. And they found that if you'd had measles, the disease, or mumps, even more so if you had both of them, it markedly reduced your premature death from heart disease and strokes. And then we look at measles. If you have correctly managed measles, it reduces your level of asthma. Not just, I think my child's asthmatic. Doctor diagnosed attendances for nebulized Ventolin, salbutamol or whatever. It reduces all of those. And then if you have properly managed chickenpox, it reduces quite significantly, even up to 12 to 15 years later, your attendance at hospital outpatients for severe eczema. That nobody mentions, well, I do in my lectures, but nobody mentions the advantages of these diseases. It's all about, will they live? And back in the 1950s, there was a very redoubtable GP called Dr. John Fry, who was an observer. Doctors used to be observers, they'd look at their patients. They wouldn't look at the guidelines because there weren't any. They'd have what they learnt, and they'd look and they'd observe things themselves, and they'd look at series of patients, and he did things like that. And there was a big epidemic in the 1950s, and he went along discussing with people how their children had got on. And by that time, there were antibiotics for the people that had what they called pneumonia complications, which you won't get if you manage the measles properly. And one of the things he said, it's on my website, on my measles page, he said many of the parents noted how much better their children were after a good dose of measles.
Yeah.
Because that's what people used to think. And the idea that we'd get rid of chickenpox, chickenpox and rotavirus are there's two such unimaginable vaccines or vaccinations to have. In both of them, we had to include, so for rotavirus, we had to include people who didn't visit the doctor, the GP, the health visitor, or anybody to make it cost effective. They have to make it cost effective. For the chickenpox, they couldn't rely on doctor statistics or health visitor statistics. They actually went along to play groups. They went along to play groups and interviewed parents to find out how much time they'd taken off work. And they've introduced it on the basis that it will save £24 million of lost work days by parents. Nothing to do with any health to do with children, nor the fact that they're going to get shingles from the vaccine, nor the fact that they're going to get chickenpox in their 20s and 30s. And of course, when I talk to people about measles in the UK, I say, well, we used to think about measles the way we think about chickenpox here, but they don't in America. They think it's deadly because they've got a vaccine for it. And of course, now, this month, they're going to introduce the chickenpox vaccine, and everyone's going to think that chickenpox is a deadly disease because it all works on fear. You have to tell them that they're going to die prematurely.
Yeah, and I remember when I was a kid, and it was never a big deal. When somebody had the chickenpox, it's, hey, all the kids in the neighborhood got together and all the parents threw them on together. So hopefully they would all get it at once. Yeah.
Yeah. And all the people who are on the edge of that developmental step would all go into that developmental step. Well, I come from a background of being sent by my parents. I grew up in the Middle East, and being sent by my parents to mumps, measles, chickenpox and rubella parties. Anybody who had anything, I got sent there. But I somehow came out of medical school thinking that, and having done community paediatrics and neonatal intensive care, thinking that if I didn't give my children an MMR vaccine, they'd die from one of those diseases. So how does that happen? And I used to think that people who didn't vaccinate their children were ignorant, and if they weren't ignorant, they were sociopathic. That's my mindset. So I've come 180 degrees round.
Yeah.
And then people come particularly because they know that I look at people holistically and I'll explain things to them. I just think it's a shame that NHS people can't get those explanations anymore.
Yeah, it's unfortunate. But hey, it all starts with the teaching, doesn't it? And if it's not taught in the schools, it's probably not going to be taught unless somebody thinks outside of that.
I'm not even talking about medical school. When you look at what it says for GCSE biology for SATs, I say to some children, I say, your parents bring you up this way and they've taught you about how health works. Just remember not to write that when you're doing your GCSEs. What you have to write for the GCSEs and the A-levels is what it says in the mark scheme. Because there's two things about learning, and I home educated my children until they were doing A-levels, is there's one thing about you learn, and the other thing is passing exams. They're not the same thing.
Yeah.
Passing the exams, you give them what they want. Learning, that's different.
Yeah, absolutely. So in your clinical experience, what actually supports immune resilience in children?
Well, having talked about vitamin D and vitamin C, for most of the time, children, they've got a load of stores. They're young, they're vibrant. They just need to be left alone. I think mainly children spend too much time indoors. They spend too much time on screens. And people say to me, oh, my child got this and they had mucus and whatever, and I gave them whatever and whatever. So I think there's a place for giving homeopathic remedies when they have an acute fever, not under any circumstances to reduce the fever, but to make them more comfortable so they drink. But the idea that someone has some snot or they're coughing something up that they need to have a remedy, you don't. They're just doing what they need to do. You need to support them, and you support them by making sure, particularly in the winter, that the temperature is not more than 15 to 18 degrees. So I say to people, don't use a thermometer on the child, because you don't look at the numbers, look at the child. Because you can have a child who's, if you measured it, if the device even were correct and accurate, and often they're not. We love those things with decimal points, like the ear things. Put it in 3 times, you get 3 different results. So it might say something like 40 or 41 or something horrendous, but the child's drinking, they're hot like a telephone box, they're peeing, they're dribbling, they're responding to you. If they're asleep, they're sleeping calmly, they have no problems with breathing or wheezing. And then, and because of that number that's probably wrong, you rush down this conveyor belt, you go to the hospital, and the next thing you think, why are they in intensive care with all these intravenous antibiotics for 48 hours until all the cultures come back negative, which they were always going to be, because if they ever took the history properly, they'd have seen that this person didn't have septicemia. And yet you look at a child who's floppy and not responding and has no energy, and you do the temperature and it's maybe 37 or 37.5 or even 36.5 low. And because it's not a high number, you don't want to be a fraud. You don't want to ring up the GP again. You do nothing. That child's got meningitis. They don't have the energy to make a fever. So, you have to look at the child that's there, and you don't worry about reducing the fever, because the fever is your friend. And where you do need a thermometer is you need a thermometer in the room, because most people overheat their rooms. And whenever they say, oh, I'm doing all that, supposedly I've got the window open, whatever. And you say, what's the temperature of your room? 21, 22. Eastern Europeans are the worst, because they really like having hot houses.
Yeah.
I don't know about Canadians. It's probably the same from the continental people who are used to having minus 30 outside. And I said, well, they need their fever, but they need to be able to lower it as well. And if it's that hot, how can they do that?
Yeah.
Lower the temperature. I've seen children who they wouldn't settle. They were really crying in pain. You just lower that temperature. You open up the door, lower the temperature in the room, and then they're fine. Because we think children are as cold as we are, but they're not. We're old and crumbly, and all our vital forces a lot lower. But the children, they've got their cells dividing at a faster rate than any time in their whole life, and they're producing internal heat all the time.
Yeah.
And so they're not cold. You're cold. You go and put on an extra few jumpers and a beanie hat. The child is fine.
Yeah. I know that from our family as well, because our son, mom being all very well meaning, she wants to make sure he's dressed warm and this and that and the other. And I'm like, don't dress him like an Eskimo. I said, he's already sweating as it is, they're definitely warmer than we are. Absolutely.
Much warmer. Yes.
Yeah.
Yeah.
Okay.
So I was about to say, that's really the answer. Don't interfere too much. But the most important thing, apart from the temperature, having some window open, is fluids. So that's what you need to get down. You have to get the fluids down them. And I say to people, have a special mug or a beaker that they only have when they're ill. Get them to decorate it, with turtles or Vikings or butterflies or whatever it is. And they only have it when they're ill. Call it, like their ill of a cup or something. Have one yourself that is like their thing, so that you keep sipping it, because children are such mimics. If they see you doing it, they'll want to do it themselves. Whereas if you're never drinking anything and you're saying drink to them, you have to. I've admitted people to hospital with something like mumps, because they were dehydrated, because they didn't get the fluids down them, because no one tells them how crucially important it is to get fluids down. Even when someone's vomiting, and it's better to do it drip, 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 because if you have a large amount and then it expands the stomach, if the stomach's a bit inflamed, then it will just concertina whoosh it all out again. Whereas if you just have a little drip going down all the time. And I recommend that people put a pinch of salt per 250 mils of water, because if you just have plain water, it flushes your kidneys, but it doesn't necessarily hydrate your cells. And I always recommend that people put a drop of Rescue Remedy in all the water that they drink. So Rescue Remedy is a flower remedy. It's for getting rid of physical and emotional stress. And I don't know anybody who doesn't have physical or emotional stress. And in fact, I think the day that you wake up, they say, well, when do I need to have it? I said, well, the day you wake up with no physical or emotional stress, and you'll probably hear angelic choirs and hops.
Yeah. I think that's great, because, when we talked about energetics at the beginning, the water is also affected by energetics, and that's why the flower remedies work. And I think for anybody that studied, Amaso Emoto's work.
Oh, yes, his work on emotions.
With that, anybody that hasn't, that's listening, I highly suggest you look that up. Imaso Emoto's work on water. It's
Or
absolutely
even just,
fascinating.
I was
Yeah,
about to say, even don't read anything. Just look at the pictures and
yeah,
the emotion underneath.
yeah, yeah,
I mean, a picture tells 1,000 words. When you see what anxiety does and what love does,
yeah, yeah, yeah,
yeah.
yeah. That's fascinating. Yeah. Okay, so we looked at nutrition, environment, stress, family dynamics, lifestyle, that all affects a child's response to infection. So we're looking at all those kind of areas. I think we got most of those right.
Yes.
Yeah, yeah. So why do you think modern medicine struggles to integrate these contextual factors into everyday practice?
Well, I think number one, it's not acknowledged. It's called woo-woo. It's all
Hmm.
this stuff. I mean, as I say to people, we're just energy with eyebrows and hair and skin on top of us, so we can see what we look like. And that's all disregarded. We do acknowledge when we talk about holistic medicine, we acknowledge that if you're stressed, you can get an ulcer, and if you're stressed, you can get back pain. That's about as much as we do. And so I am a homeopath, which gives me a big entry into people's feelings and their personality. But I'm mostly a naturopath because you have to have the right building blocks for what you need to do. And I don't know why they don't integrate that, because it's quite scientific, really. And it's just looking at what the body is. But we've just gone down this pathway of a pill for every ill.
Yeah.
There was somebody called Balint. He was a Hungarian doctor in the 80s who did a lot about the doctor, the doctor, the drug. The doctor influences how the patient is going to be. And we try to go down that way in general practice, but we've just crushed it now. We all have targets. So, for example, as a doctor, you're not allowed to do the best thing for your patient. So I actually left the health service. I left the NHS in 2020, when at the end of 2019, they made it clear to me, the Deputy Medical Director of NHS England made it clear to me that if there was a clash between the best interest of the patient and NHS policy, if you wanted to work in the NHS, you had to follow the policy, which is not what I ever signed up for.
Mm.
GPs are supposed to be independent practitioners, but they're not. They get part of their money based on how many of what their patients' cholesterol levels are. They get their money based on, which means how many of them are on statins. You get their money based on what their blood pressure levels are. I mean, we're supposed to be independent, professional people that you allow to sign passport forms because we're supposed to be honest. And yet they've turned us into robots that have to follow guidelines or get penalized financially,
Mm.
which is wrong. And so it started in the early 20th century with the using medical drugs, which were byproducts of the petroleum industry. And Rockefeller pushed a lot of those, even though he used a homeopath himself, because a dollar's a dollar. And now we use these terribly powerful drugs. I mean, when a lot of people think that many of the deaths during the Spanish flu were due to the massive doses of aspirin we gave people, which made their lungs fill up with blood and die, because they were using gram doses rather than 300 milligram per tablet. Aspirin's actually a very good drug. It's an awful lot better than paracetamol and ibuprofen. But that's when we started the pill for the ill. And this scientific thing, you talked about the science not being settled. Well, by definition, that's not scientific, because it comes from Skio, I know. So it's all about knowledge, and you should be pushing the frontiers of knowledge to learn more and more. And if you look at the things, I mean, we used to give people arsenicals as for heart disease. Well, we don't do that anymore. Why? Because science said it's actually poisonous. Changing science said that, but there's only certain sorts of science. So you have somebody like Andrew Wakefield. He did his study on 12 patients or something to say that, the parents ascribed it to having had an MMR vaccine. That's the same as the chap who did the rubella syndrome babies. What was his name? The ophthalmologist from Australia. He noticed that he had all these babies with cataracts that the anaesthetist didn't like anesthetizing because they had heart problems. And he listened to the mums, like John Fry, the GP did. He listened to the mums in the waiting room talking about having had this rash while they were pregnant. There were some other complicating factors. They had an army base near where they were, and you know what they do with soldiers. They give them so many interventions at various times that I don't know how much of it came from there. But when he published his little series, of course, he was scoffed at because, number one, he wasn't a public health doctor. He was an ophthalmologist. Number two, he was Australian. What do they know? And it wasn't until about 10 years later that somebody wrote about it who was a disease doctor. They listened a bit. It's not just in medicine. The chap who wrote about tectonic plates, he was laughed at because he wasn't a geologist. And now every school child knows that all the continents sit on tectonic plates, and that's why you get volcanoes and things. There's this thing about the status quo and about evidence base, where we disregard what we see. So in court of law, the highest level of evidence is what you see. And in the court of medicine, the lowest level of evidence is what you see. You have to do this evidence-based, what they call evidence-based medicine, which it isn't. So we've just twisted ourselves around. And there's I don't know who they are, but the peer review is supposed to ensure quality, but it doesn't. It ensures you don't rock the apple cart in that specialty.
Yeah. Yeah.
You don't mess up my pie. And it's always the same. First of all, you scoff at it, then you start accepting it, and then it becomes mainstream. But then some other stuff all comes up. So I just think the problem with doctors is we have life and death. God has life and death in his hands, but we have life and death. It's a very intimate thing that we have. And we have this enormous responsibility to use those powers to the highest good. And we've sold our souls for profit.
So in that vein, do you think medicine's desire for certainty and control has come at the cost of wisdom and humility?
100%. 199%. Yeah.
Yeah.
And we don't look and we don't listen. And then, but it's not even that. It's the enormous arrogance. There are some lovely doctors who listen, some lovely doctors who do whatever. They're pretty much conscribed. I saw doctors during COVID saying, I don't know what to do about this. If I say anything, I'll get chucked out of my job. But so many people are arrogant. I call it arrogant in their ignorance. At least if they went off and looked. So what happened to me? People kept saying there's a problem with vaccines. I knew they were wrong. But it went on and on. So I thought, I need to find this out myself. I need to start reading these things. So I started reading them and I thought, oh. And I find this even now, somebody will say something or I'll find something and I'll think that can't possibly be true. And then I'll go off and do some research and I'll think, there was diabetes. Amazon, Dr. Amazon. Amazon is pretty good. If you want to know something about drugs, you go on Amazon. It says something about diabetes, chromium and B3. So I went to PubMed, I looked up chromium and B3 to do with diabetes. Lo and behold, it has a big effect on controlling type 2 diabetes. And I thought, I went to a top London medical school. I keep up to date. I read. I do postgraduate stuff. How come I don't know about that? How come when I put diabetes into Amazon, it tells me about chromium and B3?
Because it's trying to sell you a product.
It's trying to sell me a product that's based on, but why is it trying to sell me that product?
Yeah.
And why is that product beneficial?
Yeah.
So when I look up on PubMed, there's a lot of published evidence that those are helpful. And how come I didn't know through any of the medical channels? How does Amazon know? Because it does it on the algorithms of people saying this worked for me.
Yeah.
And yes, they want to sell things, but they want to sell things that help people because that means they'll sell more things.
Yeah, absolutely. Yeah.
And how come I didn't know with all my keeping up to date? How come I didn't know? But when I looked it up, that was the case. So I'm always looking things up to see what's what. And I think, wow, how come I didn't know? And I think that's what we should always be like. Doctors don't have to know everything. They need to know some red flags. They really need to listen to their patients.
Yeah.
Because the great doctor, what was his name, who did all the algorithms? He was born in England and he lived in America. He used to say, doctor, listen to the patient. He's telling you the diagnosis.
Yeah, absolutely. Absolutely. It's you should be able to work with your doctor. And I've talked about this before. Instead of the doctor scoffing the patient for using Dr. Google or doing the research.
Use Dr. Google.
That should be celebrated. That should be celebrated. And then the doctor should look at it with the patient and go, well, okay, let's see, does this make sense here? And start discussing it there, work with the person. And I think we get much further if we do things like that. And often, especially these days, patients can be actually more informed than their doctors because they have more time to look and research things. So again, if we're working together, you got the information. Does this make sense scientifically, biologically, et cetera, and then we come up with a plan.
Yeah. So, some of the time I spend seeing patients and I have my appointments a minimum 1 hour and for new appointments, they're 1.5 hours. And when I was one of my mentors was saying, why don't you make them all 1 hour and 3/4 of an hour, and then you can see more patients? And I said, look, I spent decades seeing people in 10 and 15 minutes. This is my pleasure. Okay. Yeah. This is my treat that I can have now. But I spend quite a lot of time, depending on the patient and what we've discussed, afterwards looking stuff up to find out what I didn't know about or what other areas there are as a research thing for myself, which I don't charge them for because it's helping me.
Yeah.
I'm learning. I'm always learning. That's it. Who is wise? He who learns from every man.
Absolutely.
And I learn so much from my patients. Even ages ago, one elderly woman, she told me about lecithin. She had this thing that looked like one of those artificial milk things, the formula milk things in a tin full of lecithin. She said, I read about whatever it was and this and this and this. And I looked it up. Now I'm talking about the 1990s. And she was correct. And she'd read it in some Sunday newspaper. Well, good for them. They don't tend to write things like that now. But yeah, I learn from my patients. They tell me things and I look things up. And I always give my patients, not necessarily my family, but my patients, 100% positive regard. They come there, I lock into them. There's a sort of certain zone I go into and I lock into them and I give them all my attention. And as I said, 100% positive regard. And then we work together to optimize what we can do with the situation.
Yeah. Fantastic. Yeah. So for parents listening today, what principle would you most want them to hold on to when making health decisions for their children?
Their gut. Because the gut's always correct. The gut's more primitive. The gut is the one that's going to save you. The gut is the one that works in pictures. If you see a child in the road and there's a car coming, and it's probably going to hit the child if you don't do something.
Mm-hmm.
Your left brain, your logical one that thinks through all the things and the guidelines, by the time it's going 1 + 1 makes 2 and 2 + 1 makes 3, it's too late. It's going to be your right brain, your gut, that makes you just hurl yourself at the child and roll onto the pavement on the other side. It's the one that's more ancient. It's the one that keeps us on the clear. And so you can get led astray by intellectualizing things, reading what you read in the newspaper, listening to the very well-intentioned advice you might be getting from anyone. You might be getting from me or you.
Mm.
But you always have to listen to your gut. And the people who do the best are the ones who listen to their gut. And eventually, over time, now I mostly listen to my gut, because the gut, if there's a clash between your gut and your brain, the gut is always right. And that's why you see mothers come along, they say, I just had this gut feeling. Yeah, that's the one you need to listen to. Don't listen to, it doesn't matter how many white coats people are wearing, how many machines go beep. And it doesn't matter if it's to do with medicine or finances or a mortgage or a car or your mother-in-law. You have to listen to your gut.
Yeah, I agree 100%. Yeah. Okay, so that was for parents. So for the clinicians that may be listening here, let me see, how do I ask this? What does practicing medicine with integrity look like in an increasingly protocol-driven system?
Well, it really means dropping the protocols, because the protocols are strangleholds. They're like wearing a straitjacket. You have to look at the person in front of you. You have to look at the guidelines, because they are guidelines. And then you have to decide whether the guidelines are the best fit for your patient. Because they're called guidelines. They're called guidelines for a reason, but they're implemented like statutory go to prison and don't collect 200 laws. So by all means, look at the guidelines. I look at guidelines. So one of the biggest guidelines that I look at is the guideline on fever. And it used to be for under 5s, but since COVID, it's for everybody. This is the one guideline nobody follows. In 2007, NICE, the National Institute for Clinical and Healthcare Excellence, they said, do not give antipyretics, fever lowers, for the sole purpose of reducing a fever in an otherwise well child. And then in 2013, they repeated the 2007 guidance and they said, do not give antipyretics to stop febrile convulsions, because they don't. It says it in the guidelines. Don't do that. You don't know how many people are detained in A&E, threatened with social workers because they don't want to give their child paracetamol or ibuprofen when they've got a fever.
Yeah.
And it also says, then it said, and it stopped calling them antipyretics, anti-fevers. It just called them paracetamol and ibuprofen. It says give paracetamol and ibuprofen for distress, only as long as there is distress. Don't give them both together. Only consider giving the other one if the distress recurs before the dose of the next one is due. Nothing about 38, 38.5, 39, 39.5 distress, like you take it for a headache. Now, there's many things you can do to make a child not distressed who's not feeling very well or has a fever. But even if you only gave paracetamol and ibuprofen for distress, there would be so much less given. We give gallons and gallons and gallons. And then when somebody gets meningitis or pneumonia or septicemia, we blame the disease. And it's the paracetamol and the ibuprofen we gave them. I remember one time in 2009, I just remember it's 2009 because that was a swine flu year. I was working in a practice where they had a hot desk. So you didn't have the room that you were going to be in to do that day. You had to wait for the previous person. So I was listening to her on the phone. So she diagnosed some toddler with flu. I tell you, in the whole of my paediatric practice, I never saw a child with flu. And if they had flu, I'd never have known because I would never have tested for it. And we were always taught that what children had was rhinovirus and respiratory syncytial virus, depending on their age. Anyway, she diagnosed it with flu. She gave paracetamol, ibuprofen, and she gave Tamiflu for a 2 or 3 year old. And the 2 or 3 year old was vomiting. So she was talking now to the pharmacy and telling them to prescribe Stemetil, an antiemetic, to this toddler who didn't have flu, and the Tamiflu. And if that child died, they'd say the child died of flu, and they didn't. They died of polypharmacy. So our statistics are all wrong. So the one guideline they should follow, they don't. But you need to not follow the guidelines. You need to take into account the guidelines so you can explain to someone why you didn't follow them. And you should have a good rationale for doing that, which is that I individualized it to the patient because of these other contributing factors. But people don't.
Yeah.
And I don't know whether it's because, in a way, some of it is because they're scared, and some of it is because they have tight rein. You don't just have the guidelines; you have practice meetings where they say you're not meeting your targets. But I think some of it is because they just not realised. They just dropped this avuncular, parochial, pastoral role. You'd either go and see the priest or the vicar or the doctor. Oh no, don't come in with any of those things. Just come in when you've got real illnesses that we can give real drugs for. And yet, the doctor, the drug, that's how you make people feel better. That's how you make them well, writing letters to the councils. Now, I can't tell you how many letters I wrote to councils who were bullying patients, or teachers, head teachers who were bullying parents or family, whatever, because that's what makes people well, these social things. And that's what we need to be there for. We're there to be the spokesman or person for the little man, because we've got a professional name like doctor in front of us. And also to, as I said, undertake a pastoral role, which is emotional rather than just giving out a drug. But we've forgotten that. And I think I think medicine has become pretty heartless and soulless, a bit like society, and it's taking us in a bad direction.
Yeah. So I think you just answered my last question. And I was going to say, so if modern medicine were to rediscover the disease ecology that we talked about, then what would patient care look like in 20 years from now?
Well, a lot of the time you wouldn't need to go in, but when you did go in, you'd get taught how to do the thing that you need to do for what you've got. You'd have an explanation of why you've got your flu, because you're tired. It's winter. It's in the winter when it gets dark, we're supposed to hibernate, but we don't. We run around having all these festivals of light and whatever. And you're a bit worn out. So if you want to get rid of stuff in fact, if you're 50 or 60 or something and you get flu, you should get a nice fever, you should get down on your knees and thank God that you're getting rid of your rubbish, so it's not being left there to become fibrotically sort of immovable in the form of heart disease or strokes or cancer or whatever. So one of my aims when people come to my Fever is Your Friend lecture is that parents in particular will be looking forward to the next time their child gets a fever. And in fact, some people say, I'm really worried about my child, they never get fevers. And I said, well, if they've got a open air enough lifestyle and they eat reasonable food and whatever, then they don't necessarily have to have one. But it's really good when you do have one. Yeah. So there's still doctors in Germany. You go along to a German doctor and they'll say, go home and wrap up warm and drink lots of hot chamomile tea. Why can't our doctors say that?
Yeah.
They somehow think that if you say that, you're not acknowledging that the person's ill. But the person wants to know that they haven't got a horrible thing. They want to know it's part of normality. And eventually, over time, the whole culture would start changing enough that we realise that these things were good. But it will take many years of deconstructing what we've done to people for them to realise. So there'll be plenty of jobs for doctors to just explain. Go home, put on your beanie hat, drink chamomile tea, turn all your phones off, lie in bed, don't eat for a bit. They still have baths you can go to. You can go and bathe in Germany.
Yeah.
Baden-Baden,
Yeah.
and that's regarded as a reasonable use of doctoring resources.
Yeah. Well, Dr. Jane, I think I'd like to thank you very much. I mean, this has been a great conversation. So that really brings us to the end of our conversation today. Um, for the listeners out there, I hope you found the discussion as thought-provoking and grounding as I did. These are conversations that invite us to slow down, question
Yeah.
assumptions, reconnect with clinical wisdom, integrity, and common sense, really. So, as always, thank you for listening. And if this episode resonated with you, please share it with somebody that could benefit from it. Don't forget to subscribe. And I will make sure to put Dr. Donegan's contact info where you can get in touch with her for consultations, to look at her many great courses, which I've been a part of some of them in the past as well. We'll put that all in the show notes. And again, Dr. Jane Donegan, thank you very much for your time.
Thank you so much for inviting me. It's been a pleasure.
All right. Take
God
care.
bless.
Thank you for joining me on the Integrative Continuum. I hope today's conversation gave you new insights and practical tools for your own health journey. If you enjoyed this episode, please subscribe, share it with someone who would benefit, and leave us a review. It helps us spread this message further. Until next time, I'm Dr. Richard Rocker. Stay curious, stay empowered, and keep moving forward on your path to integrative health.